Good morning. So, in the same topic that in the chapter, we are continuing yoga chapter, and the topic that previous video we have discussed preventive prevention and management of common lifestyle diseases. Prevention and management of common lifestyle diseases. So, we had discussed about the obesity in the previous video, and now we are discussing diabetes. As the diabetes, we know that is sugar problem. The sugar tolerance problem of the body means sugar is carbohydrate. Carbohydrate is measured by the presence of sugar. We say monosaccharides means one molecule of sugar. Carbohydrate measured like disaccharides means two molecules of the sugar it contain. Polysaccharides it contain many molecules of the sugar, more than two molecules of the. So saccharide, that is saccharide solution. So diabetes is the problem of that is saccharides, sugar. Sugar is not being tolerated by the body. We will discuss in detail the diabetes. So actually, the sugar or the glucose, because this is carbohydrate, glucose, that which is very important component needed for our life, for our body to perform various functions. That's why this sugar, when we take the sugar or carbohydrate that goes into a stomach, and it is absorbed by the blood vessels from the villi, and it goes to the bloodstream. After going into the bloodstream, it is regulated by the hormone that is known as insulin. After reaching into the blood, after coming into the bloodstream from the digestive system, from the small intestine, so this sugar, this glucose, this carbohydrate, it must be regulated properly. That regulation is the insulin hormone is responsible for this regulation. How it can be transported from the bloodstream to different required body cells. Getting? Blood is the medium of transportation, as we know. So when the sugar comes into the bloodstream, so it must be transported definitely. So it's it is transported by the help of insulin. That is the hormone produced by the pancreas, especially the beta cells of the pancreas. I will discuss in detail about it. So, insulin, Hormone in our body controls the level of sugar in blood. When body does not produce sufficient amount of insulin, or when insulin does not work properly, diabetes occurs. So it is clear now. Insulin hormone in our body controls the level of sugar in blood, and when body does not produce sufficient amount of insulin, body means that only pancreas produces insulin. So if pancreas does not produce sufficient amount of insulin, or when insulin does not work properly, it is produced but it is not working properly, so that both the conditions the diabetes occurs. People with obesity are prone to diabetes. That in previous in I have also discussed that obesity is the doorstep of various lifestyle diseases. So common symptoms of the diabetes, I will tell you a lot about the diabetes. Just see the common symptoms, because glucose, sugar, sugar molecules are not being transported from the blood to the cell, because if they are transported to the cell, so definitely they will be oxidized and energy will be produced, and they are not being transported and they remains in the blood. So what will be there? Sugar is the name I am telling you, that is, this is carbohydrate, glucose, and this sugar we can see in our daily routine life. If we see, we use sugar, that is sugar used in tea, milk, coffee, etc. That sugar, when we are using in high amount in milk, in high amount in coffee, so what we will see? We will see the thickness, especially when you prepare jalebis and etc. thing. Then we see, then we that sugar, when it is concentrated, so it is very thick. It becomes very thick. That's why when the sugar will remain into the blood, so it will increase the thickness of the blood, the density of the blood. So blood has a proper density. That's why blood moves to different parts of the body and smallest structures too. So when the thickness is increased, the density of the blood is increased, the blood is unable to move. So it leads various problems. So diabetes means when the sugar is not being tolerated by the blood, by the body, and it remains into the blood. There is certain level of sugar is already in the blood, and it is continuously, as demand of the body, it is regulated, it is sent to the cells for oxidation and the energy is produced. In case of diabetes, this process is delayed, or this process is stopped. So people suffering with diabetes have this is commonly we can say the sugar problem is there. But sugar problem means that is the glucose level, the level of the glucose or sugar in the blood is not maintained and not being regulated by the body. Either it is increased, either it is decreased. When the sugar level decreased, then there is the problem. When the sugar level of the blood increased, then there is the problem. The sugar level should be maintained, and then this sugar should be, this glucose, this carbohydrate must be transported according to the demand of the body. Common symptoms of the diabetes: feeling of tiredness, need to urinate frequently. The diabetic people go urination frequently. Numbness in hands and feet. Blurred vision, very serious problem. Blurred vision, definitely it is seen when the diabetes increases rapidly, quickly. Excessive weight gain or weight loss. Unhealing of wounds, prolonged wounds. Sometimes the wounds of the body are not being healed up. So various symptoms. Now further we will discuss. This is the first slide I am telling you. So no, the diabetes is basically of two type, that is type 1 and type 2. According to the nature and production of the insulin. No insulin produced by pancreas in type 1 diabetes. Rare type of diabetes it is, when the no insulin produced, very rare cases we can see. Daily insulin injection is required for treatment. In this case, insulin injections are given to the patient daily, because insulin is not being produced by the pancreas. Pancreas beta cells are not producing the insulin at all. Second type, type second, sufficient amount of insulin is not produced. Sufficient amount of insulin is not produced according to the intake of carbohydrate and sugar. Carbohydrate or sugar, same thing is it. Carbohydrate, sugar, glucose, it is same thing. Insulin produced is not used properly. Either one another case, that insulin is being produced, but it is not being used by the body. The combination of insulin and glucose is not proper. That's why because the glucose is transported by the insulin. Frequent type of diabetes. So why the diabetes is there? What should be the sugar level? We will see here the sugar level chart, that normally in, that is sugar, what should be the sugar? 70 minimum and 100 maximum. Fasting means whenever we have not eaten anything, we have not taken any food, because maximum of the food whatever we eat, it contain carbohydrate, that in obesity I have discussed. Maximum food whatever we eat in our meal, whatever the food contains are there in our meal, breakfast and lunch and dinner, maximum it contains the carbohydrate. So fasting means before eating anything, before taking any meal, before eating anything, the blood sugar must be 70 minimum and maximum 100. If before 70, it will again cause the diabetes. If it is more than 100, then there is also the diabetic cases. Pre-diabetic condition 101. Fasting I am telling you right now, 101 minimum and 125. Pre-diabetic condition means the person is going to be suffer with the diabetes. It is still not diagnosed because the 100 above means the person may suffer with diabetic problem. If there is 100 above fasting sugar in the blood, so it means the person may suffer with the diabetes. So 101 to 125, that is pre-diabetic condition, and after 25 above, if the sugar level is found, so there is the diabetes is confirmed in the individual. And same thing, that is PP after the food, after the meal, or after eating anything, whatever you have taken the food, then after that, if you are going to diagnose the diabetes, it is diagnosed by the taken the blood, amount of the blood. So we will see here further, then I will tell you how to diagnose the diabetes. So 2 hours post meal, after meal 2 hour. So because when we eat anything, so definitely, as I was telling you earlier, it contain maximum amount of carbohydrate, so that immediately show the sugar level more. Immediately after eating, if you will check the sugar level, so then it will be definitely more. But that is not the sugar, that is not diabetes. 2 hour after, 2 hour post meal, if the sugar level is more than 140, or it is 140, then it is normal. Not more than 140 means it is less than 140, then it is normal. More than 140 to 200, it is pre-diabetic condition in case of after meal. And if it is above 200, so it is definitely the person is suffering with diabetes. So this is the sugar level I have told you. Then type of diabetes, then diabetes is of two type. We have discussed type 1, type 2, but actually the diabetes is of two type. It is hypoglycemia and hyperglycemia. Hypoglycemia, hypo means less, hyper means high. Glycemia means that is the glucose level in the body, the blood sugar. So hypoglycemia, low blood sugar symptom. There is the low blood sugar in the body. Hypoglycemia treatment, hypoglycemia, normal blood sugar range, blood glucose, all are covered. So hypoglycemia means when the person has low sugar level, then 70 is normal, we have discussed. When it is below 70, that is very dangerous condition. The glucose level in the blood is very less. So hypoglycemia is there. Hyperglycemia, it's high blood sugar. So both condition we can understand. Hypoglycemia and hyperglycemia. Then we will discuss then type 1, type 2, type 3. Diabetes and its type. Hyperglycemia is also as following, as following types. Hyperglycemia is now type 1, diabetes, body does not produce enough insulin. Clear? That we have discussed in previous video. Type 2 diabetes, body produce insulin but cannot used by the body. Can't use it well. And gestation period is known as the pregnancy period. So gestational period and gestational diabetes, which is temporary condition in pregnancy. Temporary diabetes occurs during the pregnancy, which is not the diabetes, but due to the pregnancy and its complication, the diabetes occurs. That is normal. Type 1 and type 2. It is clear now. Type 1 diabetes, body does not produce insulin. Second, body produce insulin but it cannot be used by the body. Clear? So, causes of the diabetes. There are various causes. Then sedentary lifestyle, excess food, obesity, stress, family history, that is genetic, increased age. As diabetes is, to understand the diabetes, why it is caused. It is caused due to the pancreas. When the pancreas is not working properly, we'll discuss about it. What is the pancreas, how it works. So, causes of the diabetes. Type 1 diabetes. Causes of type 1 diabetes. So, here, endocrine diseases means hormone is not being produced properly. Heredity, predisposition means heredity, we know the genetic characters come forward to the generation. The parent have history of diabetes, so then the children may suffer with the diabetes. Predisposition means that sometimes the parental history that they have avoided the sugar or carbohydrate rich food and the children are taking it, that may cause diabetes. Parents have avoided certain food, carbohydrate rich food, but children are taking, that can cause the diabetes, type 1 diabetes. Autoimmune disease, immune system is not working well. Viruses and infections which have affected the pancreas, that pancreas is not producing the sufficient amount of insulin due to the virus and infections. Autoimmune destructions of beta cells. Beta cells are the part of organ of the pancreas which produce the, especially the beta cells produce the insulin in the pancreas. We will see further the structure of pancreas. Damage or removal of the pancreas, sometimes due to any infection and anything else the pancreas is removed. Unfavorable environmental factor, the environment is not good, which is dangerous for the pancreas and for the human beings, for the body. Drugs and chemical toxins, these are the for type 1. Type 2, this is for type 1, causes for type 1 diabetes. Type 2 diabetes, causes of type 2 diabetes are inappropriate hepatic glucose release, beta cell dysfunctions, visceral obesity, adipocytokinesis. Adipocytokinase means adipose tissues are known as the fat cells. Adipocytokinase means that these cells have inflammation. The fat cells have inflammation. There is problem with the cell to store and to regulate the fat or carbohydrate. Resistance to insulin action. Sometimes insulin is not being tolerated by the body. So type 2 diabetes is there, where the insulin is produced by it is not, but it is not working properly in type 2 diabetes. It is clear? So we are going to the next slide. I will tell you how the pancreas produce the insulin. Pancreas is this organ of the digestive system, and this is just located towards the left side below the heart, and this organ is especially the produce, this is endocrine organ. It produces a lot of fluid or hormones, pancreatic juice, insulin. Especially the insulin is produced by the beta cells. There we can see the flower shaped structure. These are the islets of the Langerhans cells, in which alpha cells, beta cells are there, and in which beta cells are especially responsible for producing the insulin. We can see the structure, that flower structure, that is Langerhans of Langerhans islets of the cells. Langerhans cells, these are not. They are in a group from which the beta cells produce the insulin only. So when there is a dysfunction of the beta cell, then it may cause a problem of diabetes, because insulin is not going to produced by the body in the sufficient amount. So that's why they can lead diabetes problem. See further, then this is now clear that beta cells of the pancreas produce the insulin, which is very important for regulating or preventing from diabetic condition. So prevention of diabetes. See there, we will see the prevention of the diabetes. First one, Eat balanced diet, regular exercise, maintain a healthy weight, reduce the intake of saturated fat, avoid rich carbohydrate food. We can prevent it because when we are eating excess amount of sugar or carbohydrate food, so then definitely it can cause the problem of diabetes. So we will discuss this in the next video, the prevention and management of the diabetes, and we will discuss another lifestyle disease also. So this is all about this video. We'll meet in the next video.